Back here at home, there are signs COVID-19 infections may be on the rise again. The Public Health Agency of Canada says it is seeing continued fluctuations in some virus activity indicators following a long period of gradual decline. The agency says this could be an early signal of increases. However, overall COVID activity is still low to moderate across the provinces and territories. Joining us now for more is Dr. Howard Njoo, Canada's Deputy Chief Public Health Officer. Dr. Njoo, a pleasure to have you on the program today. I wanted to ask you about the latest data out from PHAC and whether or not you're concerned about the rise that we're seeing in COVID-19 cases, especially with the subvariant EG5 being one that many are watching.
Well, I wouldn't say I'm concerned, but certainly we've been closely monitoring the situation. We'll continue to do so. For example, with our wastewater surveillance, the EG5.1 subvariant that you just mentioned, we've been seeing that in Canada since about May of this year. And so we're monitoring the situation. We're obviously working closely with our provincial and territorial colleagues to look at the case counts. So we're looking at hospitalizations, which we know is a lagging indicator. And as in years past, we can anticipate that, as the fall approaches and people tend to congregate more indoors with the colder weather, plus, the return to school and workplace from summer vacations, that we may get a rise in cases, but we're keeping a close eye on it.
Well, given that it is not fall yet and that many people in this country are still enjoying time outside where they can, is this rise that you're seeing, though, if you could put it into context for us, is it an indication that perhaps our immunity as a group, as a country, as citizens, is starting to wane?
Well, it's interesting. We've been looking at the evidence, and certainly what we have in Canada, as in many parts of the world, is what we call something called hybrid immunity, which is a mixture of people being immune both from natural infection from the virus and also obviously being protected by vaccines. But as we know to date from the information and evidence we have, that the immunity is not lifelong. It usually lasts up to about 6 months or so. And so with different people in the population being in various stages of the time since their either last infection or the last vaccine dose, it changes every day. And so what I would say is that it's important to keep up to date, obviously, with your protection and vaccination. Certainly, if it's been over 6 months since your last infection or let's say your last vaccine dose, that certainly you should see your healthcare provider and talk about maybe getting up to date with your vaccinations for COVID-19.
Well, we have seen an increase in cases of EG5 in the UK and other countries in the US. How concerned are you about EG5, this subvariant of Omicron that we're seeing in Canada? How closely are you monitoring it?
Well, we're monitoring very closely as our colleagues around the world. As I mentioned, we've been seeing it in our wastewater surveillance since May of this year. Right now in Canada, it accounts for about, just a bit less than 20% of sort of new cases that we're able to detect. But like I say, it's something that we'll have to continue monitoring because the virus continues to evolve. So far, the good news is that although there might be a competitive advantage of this strain compared to previous strains, it doesn't appear at this point that it's causing any more severe consequences in terms of health impacts. But having said that, I think, all of the good measures that everyone's well versed in, sort of the use of, face masks as appropriate in sort of indoor closed spaces, if it's crowded, good hand hygiene, respiratory etiquette, and keeping up to date with vaccines are all layers of protection we should continue to think about, especially as we head into the fall season.
And Dr. Njoo, I do want to ask how concerned you are about some experts that we've been speaking with have expressed concern about the possibility of another triple threat of respiratory viruses this fall: RSV, the flu, and COVID-19. How much of a concern is it for you and your colleagues at PHAC?
Well, certainly we saw what happened last year. We don't want a repeat of what happened. So I think, the key is really being aware, and, prevention is obviously a much better way to go. So I would say, again, when you talk about the triple threat, we do have vaccines for COVID-19 as well as influenza. And certainly besides the COVID-19 vaccines, I would strongly recommend everyone think about getting a flu shot this year. So at least you're protected against those two viruses. And as for RSV, well, there are treatments available. I think all the other layers of protection in terms of, just good hygiene and of course, for the young kids, there are treatments available if it's necessary. And for adults too, I think as it was just recently announced, there is a vaccine approved. And so with all of these things in place and the tools at our disposal, I think a prudent approach is I think the most important way to go in terms of trying to prevent cases so that hopefully at the end of the day, our healthcare system doesn't get overloaded.
Okay, Dr. Howard Njoo, Canada's Deputy Chief Public Health Officer, thank you so much for joining us today. Some stories we're following